and Yolande from 2M Corp to present that implementation. Over to you, Momodu, Yolande.
Thank you, Saurabh. Share my screen. Hear me?
Yes,
Yes, we can
a
hear you.
little
Okay.
choppy, but yes.
Can you hear me now?
Yes.
Yes.
All right. Thank you. So, good morning, everybody. This is Yolande from 2M Corp. So, I am presenting the open.
I'm not able to hear Yolande. Is everyone else?
Okay. I paused a bit. I'm
Yes,
not
same on my
sure.
side.
Can you hear me now?
Yes.
Okay. So yes, so just to take you through briefly what we'll be discussing about the catch. One is we're going to talk about Kachma, then two, we're talking about the Kachma scheme and the openIMIS customizations for Kachma. So the Kachma implementation is the openIMIS Kachma implementation is basically for health. So Kachma is the Kaduna State Contributory Health Management Authority, and it's it's a statewide, actually, not a nationwide state, just for the state of Kaduna Insurance Management Scheme. Current total enrollees in their system is around 400,000. They have an existing custom built system, and the population of Kaduna is over 1 million. And some of the stakeholders that are part of this insurance scheme are primary health facilities, secondary health facilities, third-party providers, and customer as the insurance board. So I'll briefly explain about the scheme. That will give more insight on who are the primary and secondary health facilities. So the customer scheme is a general package for everybody. It provides coverage for both formal and informal sector. The scheme consists of primary health facilities and secondary health facilities. So the primary health facilities, these are the health facilities that are selected where and insurees can go and receive primary healthcare services at no cost to them. In the event that further treatment is required, which is not available at the primary health facilities, then they are then referred to the secondary and the tertiary health facilities. So the primary health facilities are covered by Kachma through a capitation, so a lump sum is given to them. And then the secondary and tertiary are paid via fee for service scheme. So these are the health facilities that provide the claims, and Kachma pays according to those claims. The benefit package provided by Kachma provides a set of items and services at a fixed price that Kachma has agreed upon with the health facilities. So some of the customizations that we did for the Kachma implementation are: one, pre-authorization. So this pre-authorization is a system where when insurees go to the primary health facility and they're provided services and they need another service that is not able to be rendered at the primary health facilities, they have to get a pre-authorization from Kaduna, from Kachma, that is the insurance board, to actually access healthcare services at the primary, at the secondary, or at the tertiary health facilities. So the way we implemented this functionality is instead of a claim just being generated by anyone, a claim is generated through the pre-authorization process. First, at the primary health facilities, they have to make a request for pre-authorization. And once that pre-authorization is granted from Kachma, then a new claim is created for that insurer. So at the pre-authorization stage, they enter the patient's information, the health facility from which the service is being requested, and the particular service. So once they go to the tertiary or the secondary health facilities, then they already have a claim number generated, which they will present at the secondary or tertiary and the person can validate that this person is pre-authorized to receive this service. At the secondary or tertiary, they are also allowed to add further services or items that have not been mentioned at the primary. So basically, they can complete or add items to the claim form. The next customization that we did was we implemented an auto generation for inquiry number as well as claim ID. The claim ID auto-generated number takes into account the hospital from which the claim is coming from. The next thing that we did was we implemented a custom percentage for formal sector. For Kashmadi, the percentage contribution is 3% of the person's income. So we did that, and we did also implement custom reports as part of the work that we did as well. We provided cleaning, transforming, and data migration from their existing system into openIMIS. We also deploying for them a grievance module and also an employer portal. So the employer portal is not part of our contractual agreement with them, but it's something extra that we're going to do for them. So it's a portal where employers at the formal sector level can log in and manage the insurance coverage for their health for their workers, providing a more user-friendly interface and a more easy terminology for them to understand. Yes, so this is the end. What I will do now is to just show the pre-authorization. Are you still able to see my screen?
Yes.
We're seeing the presentation.
Okay, let me
yeah.
just stop and share again.
In the meantime, I just put a link to a pre-authorization incubator page that we had on the wiki. We had discussed this functionality before in the community. We hadn't developed it further. It was just an idea. So great to see that the functionality has been worked on in Kachma, and would be really interesting to see what we can build into the main branch later and see if the functionality is available from openIMIS, the standard product.
Okay, can you see my screen now?
Yes.
All right, so here added this feature into claims. When you go to claims, you can click on pre-authorization to be able to add a new pre-authorization. So let me click on existing. This one. Let me click on this. So you select the insurer and then the receiving health facility. That is where this would be the secondary or tertiary health facility, the referring health facility. Then an existing diagnosis that has been given from the primary. So let's say something like this. Then service that they are requesting from there's further explanation can provide. The ones that is created, you can go back. So here is the one that I just entered right now. So I am logged in as an admin, so I can actually see all of this to be able to approve, but you can set the approval at the level of. So you can either approve or choose to reject for whatever reason. And if it's a rejection, you need to enter, or you can enter a reason for the rejection. So we'll approve this one. Confirm. So the information has been approved. Then if you go to the claims section now. Yes, so last JAWNA is the one that we just created with the customer number. And you can see the information regarding the diagnosis, the referral from which health facility it came from, the referral health facility is here. So you can go ahead. So this person is not actually doesn't have a policy. So if that person had a policy, you'll be able to add information regarding the extra services or items for which the person has been treated into the health facility, in the secondary health facility. And from here, the claims process as we know it in openIMIS will proceed. Kachma would get the information regarding the claim from this individual from the health facility, and then the process proceeds. Yeah, I think that's basically it from my end. So the employee portal is currently being worked on. It's not yet ready for showcase, but hopefully in another meeting or such, a Gumzo or something, we'll be able to demo it.
Thank you, Yolande. That was really interesting. Any questions from the group regarding